Hey, 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 it is I, Dr. Jeff Williams with Creekstone in Amarillo, and your host for the Chiropractic Forward podcast. This week is called Brand New Information Based on Results Chiropractic Proven Effective for Low Back Pain. Yep, this entry is all about chronic low back pain. By now, as I've said in the past, even traditional chiropractic-hating, torch-wielding, get the beast, quasi-scholastic detractors are admitting that yes, chiropractic is indeed helpful for low back pain. When we define chronic in the context of neuromusculoskeletal complaints, we define it as being a complaint that is greater than 12 weeks in duration, right at 3 months. Now, some patients, they come into the office having had a condition for 15 to 20 years. I tell them, you're just a little more than stubborn putting up with something for so long like that. It's common sense to me that a condition that is chronic, it's going to be more difficult to treat, right? Common sense. Also, most chronic conditions can be traced back to a biomechanical neuromusculoskeletal origin. One of my favorite quotes is from Dr. Lee Green, professor of family medicine at the University of Michigan. He said, neck pain is a mechanical problem, and it makes sense that mechanical treatment works better than a chemical one. You've probably heard me say that one before because I love it. Although Dr. Green here is referring to neck pain in this instance, it's spinal, and low back pain is spinal and can easily be substituted. What he says, it just couldn't make more sense, y'all. It's an easy and very concise way to understand why chiropractic manipulation and mobilization is so incredibly effective, above and beyond anything else for this sort of an issue, including medication. I've overheard medical doctors before, a few times, honestly, talking about having back pain and just injecting themselves with something to try to get over it. And I'd argue, if they asked me, that they're just covering an underlying trigger or cause, and they're ignoring it to their detriment. It's my opinion that medication for neuromusculoskeletal complaints is kind of like unplugging a smoke alarm because you don't like the racket, but the fire's still slowly growing, right? This stuff makes sense. It's easy. What have they done, honestly, to treat anything in a responsible and effective way? Nothing. Nothing at all is what they've done. Okay, let's go over some low back pain statistics. Low back pain is the single leading cause of disability worldwide. My goodness. 8 out of every 10 people will experience back pain. I'm going to admit, in 45 years here on this earth, I'm not sure I've ever met somebody that was in the 20% that apparently never suffers from any low back pain. So I don't believe in unicorns either. I think that's a 100% deal. Did you know that back pain is the second most common reason for visits to the doctor's office, right behind upper respiratory infections? With such gains and leaps in the medical industry, as far as different treatments go and technology, low back pain, for some reason, is still stubbornly on the rise. Did you know that more than half of Americans who experience low back pain spend the majority of their workday sitting? 54% to be exact. How about this one? Did you know that an equal number of patients with back pain seek help through a chiropractor first as seek help through a medical practitioner first? I didn't know that one, so researching this week's episode really, I learned something new. It's great. Back pain in general costs $100 billion every year when you factor in lost wages, productivity, as well as legal and insurance overheads. Okay, now that we're done with statistics and we all know more about low back pain, let's go through some things that may put you at greater risk of suffering from the condition. Age, that's a big one. As the spine and supporting structures, they age and they start to decline, the rate of low back pain understandably increases. How about fitness level? Physically active people don't suffer low back pain at the same rate that inactive people suffer. A healthy exercise and core building protocol really does help reduce symptoms or instances of low back pain. Weight gain. Being overweight or obese and gaining weight quickly will place increased strain on the low back. Understandable. How about pregnancy? This one goes without saying. Pelvic changes and weight gain both contribute. And then genetics. Some forms of arthritis or other systemic conditions, they're just genetic and unavoidable, unfortunately. Work responsibilities. Jobs that include heavy labor and or twisting or expose people to vibration consistently can be problematic. Jobs that require long periods of sitting in a chair can be equally problematic, just like we mentioned before. Here's one we don't normally think about. Mental health factors. Many people are able to deal with chronic pain, right? But anxiety and depression, they're conditions that can cause a person to focus on that pain, which tends to raise the perceived severity and significance for the person suffering from the condition. And here's another one we don't think about. Improper backpack use for kids. Kids suffer back pain needlessly because, they're not traditionally in an age range that we'd consider to be a risk factor, right? But backpacks used improperly, they're a common culprit for kids with back pain. A backpack should never be more than 10 to 15% of a child's body weight, and it should be carried on both shoulders with the bottom of the backpack being at or about waist level. So, now that we've covered some just general knowledge on low back pain, what does the research say? Well, the research says quite a lot, to be honest. In fact, there's more research for the effectiveness of manipulation mobilization in low back pain than for any other conditions chiropractors commonly treat. The research shows chiropractic beating general practitioners in effectiveness as well as in cost. The research shows chiropractic beating common medications that are prescribed for low back pain. The research shows chiropractic beating physical therapy and exercise protocols alone. The research shows chiropractic beating epidural spinal injections for low back pain. Basically, the research is clear, folks. In January of 2018, a brand new research paper dealing with manipulation and mobilization was published in Spine Journal by Ian Coulter, PhD et al. And it was called Manipulation and Mobilization for Treating Chronic Low Back Pain, a Systematic Review. Spine Journal. Now, Spine Journal sounds a little bit kind of like maybe a chiropractic publication and maybe biased towards chiropractic, right? It's not. Spine Journal is one of the most highly respected research journals available. It's widely read by orthopedic surgeons, neurologists, neurosurgeons, and just about any other practitioner interested in the spine. This project was funded by the National Center for Complementary and Integrative Health. Here's why they did it. The authors of the paper stated that there remained questions about manipulation and mobilization efficacy, the proper dosing of the techniques, how safe they are, as well as how they compare to other treatment protocols commonly used for chronic low back pain. I have to say that I didn't have any questions remaining. I'm very confident, but it seems that these other authors did. And hey, I'm all for research that just continues to validate the profession of chiropractic. So kudos, I love it, thank you. Now, here's how they did it. This paper was a systematic review and a meta-analysis. They searched databases for relevant studies from January 2000 all the way to March of 2017. They chose randomized controlled trials that compared manipulation or mobilization to sham treatment, to no treatment at all, to other therapies, and multimodal therapeutic approaches. They assessed bias using the Scottish Intercollegiate Guidelines Network. Now, I'm not a researcher, so that's a new term for me. I love learning new stuff. The grading of recommendations, assessment, development, and evaluation, also known as GRADE, was applied to determine the confidence in effect estimates. These people did their homework. 51 trials were included, and here's what they found. 7 of the trials showed manipulation or mobilization reducing disability when it was compared to other forms of therapy. And further analysis showed that manipulation specifically was responsible for significant reduction in pain and disability when put up against therapies such as exercise and physical therapy. Mobilization was also significantly more effective when compared to exercise regimens for pain reduction, but not for disability. So to wrap it up, put a nice bow on the package and gift to you, in the conclusion of the paper abstract, the authors say, there is moderate quality evidence that manipulation and mobilization are likely to reduce pain and improve function for patients with chronic low back pain. Manipulation appears to produce a larger effect than mobilization. I'm going to say that again. Manipulation appears to produce a larger effect than mobilization. Both therapies appear safe. End quote. You're welcome. As I've said many times, a lot of research in your favor becomes fact, right? Chiropractic has a lot of research in its favor. Just another reason to call a chiropractor today. Research and clinical experience shows that in about 80 to 90% of headaches, neck, and back pain, compared to the traditional medical model, patients get good or excellent results with chiropractic. It's safe, more cost-effective, decreases chances of surgery, and reduces chances of becoming disabled. And we do this conservatively and non-surgically, and we do it with minimal time requirements and hassle on the part of the patient. And if the patient develops a preventative mindset going forward, we can likely keep it that way while raising the general overall level of health. Please feel free to leave a comment. Tell me your thoughts. I'd love to hear what you think, and share. Did you know sharing is caring? We can't make a difference without your help. Be sure to find us on social media sites like Facebook, Twitter, Google+, Pinterest, LinkedIn, Snapchat, and Instagram. Also be sure to subscribe to our YouTube channel. The link is in the description, or hit the subscribe button below. At the very least, can we talk you into giving us a thumbs up? A gesture that simple and quick really helps us to get in front of more people looking for this kind of information. So if you would, go ahead and hit that thumb button right now, would you? Now be on the lookout for our new podcast called Chiropractic Forward. It's up and it's running. We're posting a new episode every Thursday. You can find us on Facebook, Twitter, YouTube, and you can find us at www.chiropracticforward.com. We'd love for you to tell everybody about that. We're having guest speakers come in on the podcast, and we're just having a ball with it. In the meantime, you can get more research-related blogs at amarillochiropractor.com/blog. Till next time, we can't wait to connect with you again next week. Have a good one.